Welcome to the Chief Healthcare Officer podcast, where we dive deep into the core of healthcare leadership, innovation, and strategy. I am your host, Dr. Fatih Mehmet Gül, and in this episode, we're focusing on the critical role of change management within healthcare and leadership. With us today is a renowned figure in the world of healthcare leadership, Vivek Shukla. Known for his expertise in guiding organizations through periods of significant transformation, Vivek is a beacon of innovation and strategic foresight. In our discussion, we will explore the keys to successful change management, the leadership principles that foster excellence in healthcare, and a glimpse into the future of healthcare innovation. This conversation is poised to be the source of insight, motivation, and empowerment for healthcare leaders and professionals everywhere. Vivek, it's an honor to have you on the Chief Healthcare Officer podcast.
Thank you, Dr. Fatih. Thank you very much. It's an honor to be here as well. Always great to speak to you and chat with you on topics related to healthcare.
No, it's my pleasure. And also, we have to just note this. This is the first episode of many, and I'm very happy to have you as my first guest. So you have a different place with me. And throughout all the experiences, I really enjoyed working with you in many challenging times. And here, I want my followers and guests to hear more about you. So I think we can just start hearing your story, Vivek. Please tell us about yourself, then we can dive into the change management together.
All right. So I have been into healthcare from the very beginning. When I started working, let's say now 24 years ago, and I have this is the only industry that I have worked in. I have been fortunate to have played many roles. I was running a hospital in the beginning when I started. It's a very small hospital, my family-owned hospital. I was running it for a while, and then I started also supporting other hospitals and hospital owners and promoters. And this was back in India to help them grow their healthcare business and their hospital in terms of business. And then I moved into Dubai, which was 12 years ago, where I was working with a large organization and I was heading for them business growth, marketing, etc. And then I again went into consulting. I did a lot of projects in the Middle East, GCC, even in the Indian subcontinent, a couple of those in Europe as well, on growing hospital and healthcare businesses. And currently I am working with an organization called Pure Health as an executive director commercial for them, where I have the good fortune of working with the hospitals division and helping them change and transform the business and help them again grow. So as you see, the experience that I have had has been in growth, which involves change, because no change means no growth. So to grow in terms of revenues, to grow in terms of profit margins, to grow in terms of market share, it needs for you to change your mindset, change the way things are done, adapt to new technologies, keep pace with the market, etc.
Sure. No, I really appreciate. Within our discussions, the version of how I want to discuss with my guests, actually, to share the experiences from both sides. So, as the hospital CEO, for me, definitely, my whole life is about keeping my operation sustainable and then to provide the best service. So in this aspect, definitely we need lots of changes. And when we talk about such changes and the growth, many people, they would only think that it is related to the private, and then the governmental hospitals, state healthcare operations do not need that one. But that's not true, actually, because everyone looks today for a sustainable operation. Self-sustainable operations are the new trend in the state hospitals as well. In my hospital, I look at the things, how to make the things in the best way and provide the best services to our people, and to continue and provide this consistent operation. Definitely, you need to have lots of growth stories. But before we go to the change management, for those unfamiliar, tell us something unique and then more details about the Pure Health company.
Well, Pure Health, as we know, has very fast become the largest network of healthcare in the UAE. They have under Pure Health several companies, which is a large hospital group, which is by the name of Saha. There are ambulatory healthcare clinics as well, a number of them. Plus, there are other businesses like there's a laboratory business. There's also a digital IT business, which is called Pure CS. There is also a business which takes care of the procurement for all these hospitals and clinics, etc. Also, Pure Health has recently acquired in the UK, and you must have read it, a healthcare chain known as Circle Health, which has more than 50 hospitals in the UK. So it's a big organization, growing big, and really an exciting place to work.
Excellent. I mean, initially, we have always heard something from Pure Health under the name of longevity. Then now you're talking to me about the hospitals. So, how does longevity play within this strategy of Pure Health?
See, longevity is an overarching vision or an overarching objective that Pure Health has. Any healthcare organization would want, in the end, to have people who are disease free or are managing their diseases actively and proactively and living longer lives. And these lives are not only in terms of the year span, but these are disease free lives or where the impact of disease is minimum on the life. So adding years, but not only adding years to life, adding also life to life throughout the lifespan of a person. That's what we are committed to and we are working towards.
I appreciate, and it's a great vision, and thanks for sharing the details. So now I think we can come to this change management in the healthcare and change management and the leadership issues. So if I may just, I mean, ask here, is change management important only for the leadership? If I'm a nurse, if I'm a radiology technician, if I'm a person working in the admission office, is it also important for me? I mean, how do you see this change management? Who should be the one managing this change in the organization? Is it only the top leadership?
Well, I think no, it's not just the top leadership because change happens at every level. And sometimes it's not just the entire organization that needs to undergo a change. You might even be part of the radiology team, and there might be a change in that department itself. There might be a new set of equipments that is getting introduced, and you are going to drive that change and make sure that the new equipment or the new diagnostic machinery is well accepted within the department, right? So it could be anywhere. It could be even you might be just part of the ICU team and there might be some changes there. You might be an outpatient nurse and there might be a need to change how outpatient nursing is done, or maybe the outpatient timings are to be changed in order to accommodate more patients. So change can happen at every level. Yes, organizational change is something which is bigger. It affects the entire organization. But even if you are working in your department or if you're working as part of a smaller team, change is, as they say, change is the only constant. So change will always happen, irrespective of what level it is.
You're 100% right. I think when I listen you, many, I mean, new projects, changes come to my mind on a daily basis. I mean, we have something changing in the organization, and I mean, such large hospital as the one that I lead. Every day we have another project with the QRM. RCAs come, and then another accreditation project comes. You have to have the task force, and each one actually brings, I mean, another important changes here. If we just look at the changes in our organizations, I mean, there might be small team changes, there might be huge changes. I mean, it would be a transition from one HIS to another, or we could have a totally new hospital. So, how do you approach leading a team, I mean, through significant organizational changes, and especially in our healthcare setting?
So I think the most important thing in leading a change is to make sure the purpose behind the change is communicated very early on. People in the organization must know what is the purpose, what's the context for this change to happen. This makes it easier for you to start implementing. And along with the purpose, a sense of urgency in getting this change implemented also needs to be communicated. Once that's done, then you would need two or three champions who are like the flag bearers of the change within the organization. These flag bearers are usually people who are senior enough to take decisions, to make a call, to get things implemented. Once that's done, you then need to find the easy battles and get some easy victories earlier on, and then build from there. Generally, I would advise not to go to the path which has a lot of resistance. Change will always face resistance, it is inevitable. But I always try and find the path of least resistance first. So if you were to, for example, ask your doctors to start morning rounds at 7:30 a.m., and there is resistance because they will have to then come early to start these inpatient rounds and discharge patients earlier, I would speak to the consultants and doctors who are more or less open to the idea and who would accept it. So I would find those ones first and I will go with them first. And then others, when they see these doctors getting the advantage of discharging their patients earlier, then the others will follow. So find the path of least resistance. So these are some of the things I can say. And of course, as you go along, you need to be flexible. You need to always learn to improvise. Don't wait for the perfect solution to come and then we will implement it. Sometimes you just have to start and then you learn along the way and you improvise as you go along.
I totally agree. I mean, if I look at my daily operation, whenever we introduce any change, every person looks at it. What is it for me? I mean, what kind of change is going to affect me and my area, my team, my space? Will they take another clinic from my side, or will this equipment bring me an additional work? And another important thing, I think, when we look at the changes in healthcare, we may have diverse teams. I mean, in one task force, you can see one technician, one nurse, a couple persons from finance, and then you may have a physician, different level of physicians as well. So here, I think we need to communicate things in the right way. So what role communication does play in change management, and how do you ensure your message is effectively conveyed across all levels of the organizations when it comes to the change management?
Communication, I think, is key. What you speak, how you speak, the tone that you use to speak what you're saying. There are two kinds of changes, two ends of the spectrum. There's one which is drastic, radical, immediate, urgent change. This one is generally transmitted from top to bottom and it has to be done like now. And then there is on the other end of the spectrum change, which is slow and steady, which is more in a way democratic, where you involve different people and you take their opinions and then you slowly try to change. Depending on which one you are going ahead with, depending on the if this really urgent and has to be done like really quickly, then it has to come from the top and the communication has to be different than if you are doing it in a more inclusive setting. Also, when you talk about communication, I would like to add that it's very important to balance the communication. So you want to balance the good news and bad news together. If you give too much of good news about the change all the time, people tend to become a little complacent and they try to not really, in the urgency, then takes a back seat. But if you give too much of bad news, even that's not good. So you need to balance. So, for example, if you're downsizing and if there is a reduction in the headcount which is needed as change, that is bad news, right? But then you also have to balance it with some good news, because if it's only going to be this bad news, then it's going to meet a lot of resistance. So you have to convey through various channels. You have to find out also, when you're talking about communication, there is a lot of informal communication that happens when a change is going on in any organization. So there are a lot of back channels, there are a lot of rumors, there are a lot of people talking about things. So there needs to be some sort of a mechanism to keep track of the narrative. The narrative should not get lost and it should not get digressed into a different direction, and then you don't know how to bring it back. So you will need to find out, to communicate your message, you will need to find out some opinion leaders within the organization. These people necessarily may not be the most senior people. These are people who are popular. These are people who are listened to by their staff and by their employees, by their co-workers. And these are the people who need to take ownership of whatever change we are doing. That helps you to communicate better and it helps you to have the influence across the organization. So finding these opinion leaders is very crucial in terms of communication. There are formal channels of communication. There are emails. There are various platforms internally, which are like the internal social media. Different companies have different, but you have your internal channels where you can post about it. There are emails that can go up from the top bosses throughout the organization. You could have certain events, gatherings organized from time to time, and all of that can be planned in advance in order to make sure that you are communicating the right message. My advice has always been to use as many of these channels as possible, because if you only use, let's say, emails to communicate, then you are limiting yourself. If you will cross promote the whole idea of the change through different various channels, you will end up being more effective in your change management exercise.
I think we shouldn't also just think about the huge changes in the organization, right? I mean, there might be something, even very small change. I am a charge nurse and I need to communicate this with my people. So then I could implement in the same way by sharing all these things with our people. And there might be also other elements here. I think we can touch the point as there might be other stakeholders, Vivek, and patients could also have impacted from this change. So then we need to explain this to the patients from time to time, especially in, I mean, senior hospitals. I don't want to say old hospitals here. There might be some renovation projects, and then you may need to close some department. You may need to shift a department to another place. Then, yes, you have to communicate this internally, but you have to also communicate this with other stakeholders. So then when your patients, they visit the hospital, they will be able to adapt better and then easier. So here, if we can just look at, I mean, a certain specific area, like let's say digital health technologies, it has been a big change in our industry. So if we just look at this kind of specific topic, can you just tell us more about challenges of implementing digital health technologies? So how could it affect the traditional healthcare settings? And then how did all the hospitals overcome them? Or what is your advice to overcome them easier?
I think the one is the digital. When you talk of technology, what happens is the infusion of digital technology within a healthcare system or within a hospital is generally slow. The reason is a couple of things in this. One is that a healthcare system has multiple stakeholders. And every stakeholder has their own interest or has their own viewpoint. They look at the business of healthcare from a different dimension. Doctor, if you ask the doctor only wants to look at what is best for my patient, and which is true. That's what the doctor must do. They must always look at what is in the best interest of the patient. It took a long time for doctors to adopt the EMRs and writing it on the computer rather than writing on a notepad with their pens and giving a prescription. So because they thought that it is an impediment, it is a hurdle in giving the best service to the patient. So you have different stakeholders. There are doctors, there are administrators who are mostly driven by the return on investments. They are driven by profits. Doctors are driven by what is best for the patients. You have the insurance companies who pay the hospitals for giving these services. They are driven by some different motives. You have also the cross section of people that work in a hospital are different. It's not like a software company where everybody is a software engineer. In a hospital, you have nurses, you have ambulance drivers, you have doctors, you have administrators, you have different kinds of people, and all of them have a different way of looking at things. So whenever a technology or a digital innovation is being introduced, everybody wants to, as you rightly said in the beginning, everybody wants to look at it. What is in it for me? What is in it for my job? And if this digital technology answers this question efficiently for every stakeholder, then that technology gets adopted. More often than not, these technologies do not answer the question of every major stakeholder. They probably sometimes answer only the question or only solve the problem for the doctor, but they do not solve the problem for, let's say, the payer. Or sometimes they solve the problem for the payer, but it doesn't solve the problem for the administrators of the hospital. So it has to solve the problem for each and every stakeholder, and then it gets implemented. The other thing which I see why these technologies do not sometimes, or most of the times, do not really succeed is because the organizations and companies which create these technologies, they are not grounded in the nuts and bolts, or not grounded in the hard realities, the ground realities of healthcare. They have a great idea, they have a fancy idea, and they are smitten by their idea. But at the same time, they don't see the practicality of it because they probably have not worked in hospitals before, or have not taken into account of people who work. I mean, they might have, but they do not take it in detail and at length. So there's a gap between what they think is a fancy idea for them and what is actually needed at the ground level. So there's generally a gap. So these are the two main things why these technologies do not see the light of the day. One, there are multiple stakeholders, and the technology doesn't address the concerns of each of the stakeholders. And secondly, the technology is far away from what is actually needed on the ground.
When I listen you, I mean, many different samples are coming to my mind. I totally agree with you. I mean, every digital health solution is actually a kind of a change management project, which you approach to your doctor, you approach to your patients, you approach to your nurses, and then asking them to use a new tool and change their practice from yesterday and implement something new. And this could only be accepted if you know the details of change management and healthcare. How do a nurse think, and daily what kind of practice they do, and what exactly is needed in their daily work? If you don't know this, you're very right. And unfortunately, there are many samples which actually have lost the whole attention on them in the market. Some engineers, they just thought that, oh, you know what, that's a wonderful solution. Let me offer this. I can change the entire healthcare industry. And unfortunately, since they did not study the industry well, their plans did not work. So at the time of COVID pandemics, I think we have seen several samples like that, and then some projects did not see the light. So then we had to drop some of them. So I mean, we just finished, if I may say, the pandemic's time, and then we have seen lots of changes, and we have seen the importance of leadership at that time. So, from your experience, Vivek, what leadership qualities are most critical in driving successful change within the healthcare organizations?
I think the most important quality is emotional intelligence. I know it's a cliche and people talk about it all the time, but emotional intelligence for me is very, very crucial. Change is not comfortable. Change will always make you uncomfortable, not only uh, not, it, and including emotional discomfort, right? So somebody who has empathy, compassion, emotionally, who's intelligent to gauge the mood of the organization, or to gauge the mood of the people that they work with, and to gauge their severity of their emotion and help them manage the change emotionally. People react differently to change, and I have seen it over the years. Some people get really aggressive about it. Some people get cynical. Some people just run away, they resign and leave the organization. So people react. Every person has their own reaction to something which is uncomfortable. So you need a leader who is a people's person, who understands people, who has a lot of patience, and somebody who can manage this emotion amongst people. So that's very, very important. The second quality for a leader in change management is, I call it clarity of thought, because you need to be very clear what you want to do and the direction that you want to take. Keep things simple. Complexity is the enemy of change, because if you make things complicated, and if you do the messaging, the way you speak, if it is complicated for your people, they will get confused, and they will use this confusion and they will hide behind it in order not to change. So keep it very simple, keep it very clear in your mind. So clarity of thought, simplicity of thought, emotional intelligence, these are the very, very important factors. And then there are sub factors under each one of them. So under emotional intelligence, it's also under clarity of thought, also it is clarity of speaking. And under the emotional intelligence, also you need empathy, listening, the ability to be able to listen. All of that comes under that. So I think these are the two very, very important qualities in leaders when they lead change.
I second what you say, and then I definitely understand what's happening in the healthcare industry now. When I listen you more, I've been writing too many notes here. Definitely, when we look at the changes happening in the organizations, if the leader does not have the empathy to understand the situation, and if the leader cannot actually create the connection with the teams, unfortunately, we're seeing lots of changes are not being well implemented. Either they are being forced and then you can't really get the best outcome from the people, or I mean, they don't work. So I totally agree with you.
Yes, I can add one more point to which is courage and ability to take risks. Somebody who's overcautious, somebody who really cannot take risk, doesn't have the courage to make a call, will not be a successful leader when it comes to changing things. Change needs courage and change needs risk taking. I'm not saying somebody should be taking uncalculated, blind risks, but a certain degree of risk taking is needed, and that needs courage. So that you can add it as a third quality for leadership when it comes to change.
Thank you, Vivek. And definitely, I mean, we need a good leadership to manage the change. Otherwise, I mean, it will not work, and lots of investments will be lost. It will be missed at the end. So then, finally, I mean, for our listeners who are aspiring healthcare leaders and not necessarily healthcare leader as the CEO, no, I mean, I would say that I will be the charge nurse of this area. I could be the main technician of this area, or I'm the one, I mean, running the maintenance part of my hospital. So we have too many aspiring healthcare leaders listening us. What advice would you give them on preparing for and managing change in their careers?
I think the first thing is to be flexible and also, as I said earlier, to keep things very, very simple. Clarity of thought, simplicity, and the ability to take risks. I think that is very important if they want to lead change. To lead change also means to be able to speak your mind in a way that brings some sort of motivation or inspiration in people who listen to you. Somebody who is really forceful and is not able to get people on board or get a buy-in from the rest of the team members is not going to be a successful change leader. So to be a change leader, you need to get people on your side with the way you act, with the way you speak. Lead by example. Be somebody who is seen as a courageous person. It doesn't have to be the designation, as you rightly said. It's not about the designation. Sometimes we have seen across several examples in history where even a small person who's supposed to be a small person, or somebody who's supposed to be not very significant in the social setting or an organizational setting, even that person can trigger change. So it just needs it needs the courage to take action, and before that it needs somebody who is able to visualize, somebody who is able to dream big and have a vision or have a dream, have something to go for, and then have the courage to take actions to make it happen. But when I say courage to take actions, he definitely will have to take actions to get people on board, to get people aligned, to get people to be the co owners of this vision that the person has. So, have a vision, number one. Secondly, have the courage to take action. And thirdly, have the ability to get people on your side in order to achieve that vision. So, I think these are the three in the chronological order which is needed for somebody to be a good change leader.
It is a great advice. And then we know one thing very well, life has changes every day, and we have to prepare ourselves. We have to be ready to manage the change within our own career life, within our own very own life. Then we can become a person to lead a change in an organization, in a department, in a hospital group, and other things. So, Vivek, I really enjoyed hearing you, and then hearing also your very systematic approach for this change management part. Do you have any other thing to add?
The only thing I have to add here is that, always look at making a difference and contributing to the organizations that you are working in. Yes, we all want to have a good salary and we want to have good perks and we want our promotions and increments, etc. But for me, it's always not the main objective. The main objective is to go and make a meaningful contribution, whether it is changing things, whether it is introducing something new. Find out what can you contribute and what kind of legacy that you can leave behind whenever you leave the organization. I think that should be the primary goal, irrespective of what your designation is, irrespective of which department you work in, and rest of the things will take care of by themselves.
Thank you so much, Vivek. I really enjoyed this talk, and thanks for joining me on the Chief Healthcare Officer podcast. To our audience, thanks for listening all the way through. Please leave us a comment if today's episode has sparked your interest, and don't forget to join us in next episodes. Thank you.